Dr. Ferguson coming to you from the Passion Camp. Wanted to talk a little bit today about the challenges that one has as they're approaching the end of their Suboxone program. Now this is it's a normal thing to be anxious. It's a normal thing to be a little uptight as you're approaching the end, as you're almost done with your medication. It's normal, and I can't overemphasize it's normal, but part of your success is drawing a line in the sand and saying, I'm not going to do any more drugs. This is what I have my patients do when we first start the program. We have to have a mindset that I'm not going to do any more drugs, regardless of the scenario. I've had patients go through heart surgery, I've had patients have bowel surgery and not go back to narcotics because they made up their mind that they weren't going to do any more drugs. Now, non-narcotic medications can be utilized for pain and can be utilized very successful. But it's a part of your mindset. If you're in a mindset already that Tylenol, ibuprofen, whatever medication we're talking about, Lyrica, Neurontin, whatever we might be talking about, if you're already in a mindset is it's not going to work, those don't work for me, then they probably won't work for you. You know, there's a saying that says if you think you can, you can. There's another saying that says if you think you can't, you can. So how you're thinking and how you're positioning yourself is so very important. So when you start any type of detox program, right now I'm specifically talking about Suboxone, but it could be anything, draw a line in the sand and make a decision that you're not going to go back to the drugs. Now, in the case of Suboxone, it's going to take care of the withdrawal symptoms. It's going to take care of those type of problems. So you don't have any physical reason to want to go back to the drugs. It's going to be a mental issue. This is why you got to draw a line in the sand, and you got to tell yourself to make a decision, I'm not going back to it. I know it can be challenging, particularly when you're starting out. You've maybe done drugs for years and years. Your buddies come over, you're tempted to do it. But if you make a decision in advance, you're much less likely to fall back into that rut of doing some drugs. And then you feel bad, oh, I wish I hadn't done them, I didn't even get a buzz from it. Well, that's what happens when you're on Suboxone many times. You're not going to get a buzz. And most times by the time a person becomes addicted to a narcotic in the first place, they're just taking their narcotics to get back to normal. And the Suboxone is going to get you back to normal, so you don't have any reason to want to do the narcotics. The Suboxone will help shrink down the receptors so that by the time you've been weaned off your Suboxone, you should have no more need for the drugs. And then it becomes a decision making again. Are you going to do the drugs because you want to, or are you going to do the drugs because you need them? And you won't need them anymore because you'll be done with withdrawal symptoms. And this is a factor that you have to come to grips with. Then as you get towards the end, anxiety becomes bigger of an issue and withdrawal becomes a smaller issue. And that's pretty much going to be across the board. So just understand, as you're having similar symptoms that you might have had when you were taking a large amount of drugs, and now you're down to 1 milligram, 2 milligrams of Suboxone, and you begin to have a couple of symptoms. Maybe you miss a day and maybe you don't feel the greatest. Maybe you had a little headache, or maybe your stomach gets a little jittery. That doesn't mean you're having withdrawal symptoms. Those symptoms, anxiety and withdrawal, can look just the same. And I would suggest to you that in all probability, you're having anxiety symptoms and not withdrawal symptoms. So on that note, just want to encourage all of you who are in the Suboxone programs and are trying to get off the drugs, hang in there. You can do it, but you gotta draw a line in the sand that you can do it. That's just so important. My line in the sand is critical. Line in the sand, don't cross that line, that you will get off the drugs and you can have success. You know, I'm not in the category of believing once a drug addict, always a drug addict. I don't believe that for a second. And with a drug such as Suboxone, you can be weaned off and weaned down to where you're no longer having withdrawal symptoms and you've shrunk down the receptors. And the only reason at that point you go back to drugs is because you want to, not because you need to. So on that note, be blessed. Dr. Ferguson coming to you from the Passion Camp. Bye-bye.